Hello, everyone, and welcome to the Bear Experiment podcast. I'm your host, Monica Clavijo, and we are recording and coming to you live from our new hometown, Orlando, Florida. So my cousins, Madeline and Barbie, came to Orlando to help my daughter and I kind of settle in with the final little touches to our house. And we're so happy with the outcome, and I'm so grateful for your help. Thank you so much. Anyway, during this trip, they were going to come in the Bright Line, and they were kind of test out the transportation, the easier form of transportation from Miami to Orlando. Unfortunately, that was not able to happen. So Barbie had to bring Oreo, Oreo the Queen of England, who is a special needs disabled dog. So we figured that this might be, we've talked about this in the past, where I think that it would be good talking points for others that are struggling with their pets, educational points for others that are struggling with this decision and everything that you kind of have to deal with right now with Oreo, who is now cannot walk, right? Like she's completely paralyzed from her hind.
Paraplegic.
Is that what it would be called?
No.
Well, I don't think that's it either. But Oreo, who is a 7-year-old French Bulldog, I knew her before and after her surgery, where she was left paralyzed from her waist down. Her hind legs do not work whatsoever, but she's also unable to relieve herself. Incontinent, aka cannot pee or poop on her own. So Barbie and her boyfriend actually have to multiple times a day push her, right? Like we
have to, it's called to express.
I was going to say extract,
Well,
but express.
You are doing that, but it's called expressing a dog. And that's for the P. The number 2, she can do on her own. It's just, she can't control it. It just happens on its own.
So she always has to wear a diaper now, 24/7. And then she's got her little doggy wheelchair, which is super cute. And she seems like she's a very happy dog. I mean, like I said, I knew her before and after her surgery. And I think I've encountered depressed animals in the past, and she definitely is not giving that vibe out, you know? So she's a very happy little girl. She's sweet. Look how sweet she is. She knows she's on television. She might be a little shy.
She's taking advantage of sitting on mommy like a toddler.
So, to help further educate people that might be dealing with this, which happens very often with Frenchies, right? We were talking about this earlier in a forum that you were participating in on Facebook. You were saying that it's over 50,000 French Bulldogs a year, is it?
So what happened to her is called IVDD. And basically what happens is that the dogs have a problem with their spine, like a disc in their spine. And for many dogs, they cannot walk again. Some can, and most times they need surgery. I've read about some people giving their dogs therapy and they get better. So I think it just depends on the level of how herniated that disc is. But it's called IVDD, and yes, I am in a group on Facebook, and there are close to 50,000 people that are on there, and they're on there because of their desperation
for answers
when their dog all of a sudden can't walk.
So let's get into that. So what were some of, clearly there were signs and symptoms that now, you know, backtracking to what you were seeing and experiencing with Oreo, what were some of the signs and symptoms that you can share with others right now that they can look for, that maybe they could have prevented the surgery where, you know, they're left, you know, with no mobility from their, you know, hind legs down?
So there were a couple of times that now in retrospect, I think may have been related to what happened to her, but I don't know for sure. On 2 occasions, she was outside walking around in the grass. Obviously, this is when she could use all 4 legs. And then she sat down on the grass, laid down, and I would call her, and she's a very obedient dog, and she wouldn't come, and she wouldn't come, and she wouldn't come, and she just was laying there. So I figured maybe she was just enjoying the sun, getting a tan. And then I came back like 15 minutes later, she's still in the same place. So grab her, pick her up, bring her inside. She's walking again. You know, it kind of stays on your mind. Like, why wasn't she getting
What
up?
happened, right? What's going on here? This is not the common with Oreo.
But you know, dogs are dogs. You know,
Right.
you don't know what's happening. So she starts walking again. So no big deal. That happened twice. And again, this is over months. This is not like over days.
Right.
And then another time she had her little leg was up. You know, like she hurt her leg, like she sprained her leg, but
Or maybe she stepped on
she stepped on
something. Yeah.
something. There's been times where she gets a sticker in between her toes. She's just stands there.
Yeah.
Yeah.
Right. So her little leg was like kinked up, and that lasted for, you know, like 2 weeks, I think it was. And she wouldn't do it every day. And it would happen where her little leg would kink up, and then, well, no, you know, I just kind of said,
Sometimes they get scared, like the first time if it's
Yeah.
like, you know, they hurt themselves and then they're scared to put it down and then you think that they're
Well, it hurts them.
Yeah.
You know, I mean, at the
She
end of the day, it
wasn't-
hurts.
but
It's
she
like if you hurt your toe or something, you're gonna
and
limp.
you're
You
scared
know.
to put it back down
Yeah.
or something, so they act it
but
out.
you know, she never winced or showed any signs of pain. She just lived, you know, was doing everything normal. So it went away. And I think those 2 incidents are related to what ended up happening. But at the time, you know, they're pets, you know,
Yeah.
it's caring for pets through doctors can be very expensive. So you really
Super.
need to know that there's something wrong with the dog, because if not, you know, it's $400 or $500
Every time you
just to
go,
find out there's nothing wrong with your dog
right.
Right.
after they do all the tests.
And that's something that I definitely want to dive into in our conversation here today for this podcast, because it's extortion also that's happening with the vets, especially in Miami, where it's just it's a money machine, and really there's no insurances available that are really of
Yeah.
any but it's really not of value, I feel.
Right.
With I've never purchased it personally, but I know many that have, and really it's not, you know, yeah, you get a discount. I guess if your dog is
Right.
sick at that
And you have
point,
to pay for it up front and then they reimburse you.
yeah, with your insurance so
I don't know anything about how the insurance works. I do know that when she did have her surgery, they did ask, does
Right.
she have insurance? And my understanding was that if she did have insurance, a good chunk of it would have been, some part of it would have been paid for.
right,
I don't know how much, because I didn't have it, so I didn't care
right.
at that moment. But, so I really don't know I can't talk about the insurance. It did seem like when I had the surgery that at that point, with how expensive it was, it would have been beneficial at that time. if
Oh,
I
for
would have
sure.
had it.
Yeah,
Sure, yeah, but you're not right. It's like anything
But
else. You're not
it's something
counting.
you expect, like, you know, when you have a dog, you don't ever expect to spend $20,000. Every year you spend regular, you know, let's say $400 a year because you take your dog
Right.
for their annual checkup. But you would hope to never expect a real big illness, right?
Right. Yeah.
No, and
So
at
it's
that
like you
point,
take your chances.
right, exactly.
Yeah. And this is honestly, the first time that I had a pet that was my pet, you know, so I wasn't really familiar with it. After going through what I went through with Oreo, I would tell someone, you know, do it, get the insurance,
For sure.
especially if it's a French Bulldog. And that's something we can talk about more, because when she did have the surgery, they told us at the facility that they were seeing way more Frenchies than they wanted, than the normal. Like,
Do you
a
think
lot
that
of-
maybe that could be kind of like an inbred situation that's happening because there's so many
It's very common in that breed.
people, right? But it's also like the inbreeding that happens with, you know, siblings when you know, the
I don't
mo-
know. Breeding
I
works.
don't really know how that works, but what I can say is that, you know, the French Bulldog was a human created breed. This is not a breed that developed from dogs, you know, how, like, you know, dogs came from wolves and blah, blah, blah. No, this was they were purposely bred to look and act the way that they do. So maybe over time,
Needy. Needy and annoying.
Not annoying, she's needy.
God. So, I do think that there is something with, over time, maybe the experiment didn't, maybe it backfired a little bit. She has a sister that hasn't had any issues. I know the owner of the sister, and the sister hasn't had any of issues like this at all. So I don't know why it was Oreo, and the doctors can't tell you why it's one dog
And not the other.
and
Well,
not
it's like
another dog.
siblings within
And also they
humans
may
as
have
well.
the surgery and they may come out okay,
Right.
because it could be not as extensive maybe as
So,
because Lisa's partner has a French Bulldog and
Oh, it has issues?
had
the
the surgery
and was
she's
fine.
Fine.
Yeah.
Right. So what happened is that, we had
Could it be the vet?
No, I don't think so. They told us, so we'll go back. So, we had guests over our house, and Oreo is a very excitable dog, as you guys know. She likes to jump up and say hi. And so we had a lot of people at the house, and there was children. So, we put her in the bedroom so she could, be away from the event. And she was scratching the door, and she was still excited, even though she wasn't in the room with everyone. I think that may have had something to do with it. She got overexcited, jumping up, and may have hurt herself.
Right.
She was maybe already semi-injured, something like that. We don't know how it happened.
Right.
But I think some of that might be connected. So everyone leaves. It's almost midnight. I bring her out. I sit her on the couch with me. We're watching a little bit of TV, winding down. I put her on the ground. Can't move her behind legs. Paralyzed. Can't move them. She's dragging around. She starts heavily panting.
Because she's in pain probably.
She was in pain, discomfort, scared, whatever it was.
Yeah. Out of the above, right?
And so I stayed with her in the guest bedroom, all night, and she never went to sleep. She never stopped panting. I really didn't know if there was 24-hour healthcare for dogs because I had never been in that situation. So early in the morning, around 7 o'clock or 8 o'clock, I start calling places to see if I could take her in. When I described what happened to her, there was a lot of places that were considered emergency facilities that were like, no, we can't deal with that.
Right.
So finally found a place, took her there. They ran their tests, several $100s. And they said that she needed to go to a neurologist. I had no idea that there were
For dogs.
neurologists for dogs. There's like,
To a neurologist.
Really?
oncologists. It's crazy. Like, when you
Kidney
think of
specialist.
a lot of specialists for dogs. But anyway, so they sent us over to a facility in Miami. And we came in, and they basically described what was happening. They did an MRI, and they described what was happening to her, and they said surgery or put her down.
Yeah.
They said she was a level 5, which is what you were talking about before. There's different levels of how bad their spine is, and she was a level 5.
That's the top.
That's the worst scenario.
Mm-hmm.
So, we were of the understanding that either you have the surgery or the dog is not going to stop panting, and she's never going to be, she's going to be in pain or whatever it is that's happening inside her.
Do you feel that they gave you an accurate explanation and description of exactly what could have taken place with, them being physicians and veterinarians and working with animals? Or do you think that they were just tugging at your emotional kind of like heartstring with your pet, and they were just like, you're gonna have to put him down unless you do this, super extensive surgery on your dog right now? And at that point, you're desperate, obviously.
I don't know if they purposely pull at your heartstrings. My partner does feel that way, and he had a stern conversation with the facility at the end of everything.
Good for him.
But what they said happened to her, right? She had a herniated disc. What they failed to mention, which is what I've learned through Facebook, is that almost like with humans, there are alternative therapies, right? There's,
Acupuncture even.
acupuncture, laser, this, that.
Mhm.
Now, would that have helped her at her level? Would we have had the time to research all that while she's suffering?
Right.
You know what I mean? So it's kind of like if we were experts on the subject, maybe we
Yeah.
could have made a different
Different
decision.
Mm-hmm.
But at that time, it was, put her down or the surgery,
Right.
which honestly, I don't think there's a problem in them saying that at that time at her level, like they said. My concern, well, my problem with the whole situation was that they were definitely not clear on what life would be like after the surgery if the surgery failed.
Right.
And the surgery failed for my dog. She's no longer in pain, but she's paralyzed.
Right.
She has to use a wheelchair.
Right.
She's incontinent, so she has to get expressed every 4 to 6 hours. If you're an ultra hygienic person, this is like a nightmare for you because the dog will poop whenever she's poops.
Right.
And so it could be on the floor. So we try to keep a pamper on her. But the problem with keeping a pamper on her is that because she's a female, she can get a UTI. And she's already gotten 3 UTIs since the surgery, which hasn't even been a year. So it's almost like every quarter she's probably going to get.
How do you know she has a UTI?
It stinks. The pee stinks. So it smells really bad.
So that's a vet visit at that point again, and they have to put them on antibiotics.
You have to get a culture. They have to send it out, just like, humans, they have to send it to a lab to find out what type of UTI it is.
Oreo, you're a disaster.
But I think they don't tell you at that moment, if you love your dog the way, I love my dog, and they say, put her down or surgery, you're going to be like, surgery. And I'm not saying that I regret what I did, but I wish at that moment they could have informed me more of what life would be like.
Do you feel that if they would have been a little more specific as to what's happening right now, you would have chosen a different route?
I don't know.
Yeah.
I don't want to get hate. People, I don't want to get.
No,
listen. You would have asked more questions also.
I think
okay, if my only decision is like either this or put the dog down, it's like, okay, can you explain to me more? Because I say my decision is like, okay, I can't, my life is so busy, I'm not gonna have time for her. So she's gonna always, she's gonna suffer.
Right.
Well, and we go back to that, in the end, a pet, a dog, a cat is a family member. Like we get to that emotional point where we love them so much and they become a part of our extended family almost. And of course, we're going to choose to keep them alive as long as we can, as we would for a child, for a parent, for ourselves. But then we go.
At the end of the day, it is a pet, right? It's not a human.
Well, and it's just like we go back. We don't have insurance. How expensive? How expensive was the surgery?
I have to say, like from that Facebook page that we're on, like I feel horrible for some people that go through this because, fortunately for us, it wasn't a financial, like it wasn't about like, am I gonna have to put all this on my credit card and how am I gonna pay this off and all that? That really wasn't a factor.
Am I gonna have to declare bankruptcy now? Yeah.
Not only that, for some people who have to work, let's say they do have the money, but they have to work 8 hours a day plus travel time.
Right.
This dog has to be expressed every 4 to 6 hours.
Exactly.
So what happens for those 9 hours? How often is the dog going to get a UTI? Because there's nothing you can do. Are they going to is your office going to let you go home for lunch?
Right.
Right. So for some people, it is a huge hardship. And if it's not explained what a life-changing situation it is after your pet goes through this, it's terrible. Yeah. And it's not only that, at the beginning, it was like, she's a dog, she's on a wheelchair. Like, dogs are supposed to have
that
some
freedom,
and be able
but
to go and sniff everything. That's their favorite thing to do.
Well, she's still doing that.
She does, but if I'm around, because if there's rocks and she gets stuck on a rock, I have to go and push her off, or you know.
Yeah, you're like 100%
I-
caregiver.
I'm
Yeah.
a 100% caregiver of a disabled dog.
Right.
It is. And even
You're doing the Lord's work, guys.
you know, and you know, we love to travel. We can't find anybody to watch her. We have one person that will watch her, you know, and I'm so grateful that he watches her, but he's a guy. So, you know, the cage isn't getting cleaned the way, you know.
Yeah.
Be careful, you may be offending some guy.
Yeah.
It's true. I might be offending some guys. This is a guy's guy though. But his dog had went through the same experience, so he'll come. But at the same time, you know, he travels and he does things, you
Right.
know, so we have to live around his schedule. And I've contacted, oh my God, I don't know how many pet boarders
And they won't take her?
They won't take her. They always tell me to take her to a medical boarding.
And that's more expensive, I would imagine,
Not
as well.
only that,
They're in a
but
cage the whole time.
yeah,
Oh.
So, you know, it's a medical boarding. It's kind of
Right.
like if you take a person
To a
to a hospital,
hospital.
they're laying in the bed the entire time. So with a dog, they're in the cage, you know, and I'm sure they do take them out, but most of the time they're in a cage.
Right.
And, you know, it's like, you know, the poor dog is already paralyzed because of my decision. Now I'm gonna be gone.
Do you blame yourself for her being in this condition? I mean, is there a guilt associated with this?
a little bit because, you know, she's my pet and I love my pet and I've spent a fortune on my dog and I'm always trying to do the best thing for her. But, you know, I grew up in a place where animals are animals and humans are humans.
Yeah.
They're not, you know, it's an animal, you know, and if an animal got sick back then, animals were put to sleep. They weren't taken to the oncologist and, you know,
No,
put
totally.
on thyroid medicine. You know, that didn't happen
Right.
back then, you know.
Yeah.
So I still have some of that mentality of like, you know, at the end of the day, it's an animal and I love her and now she's in this situation. I'm gonna give her the best care possible. But
Oh. She's She's like,
Just kidding.
she's like, don't put me to sleep.
I know.
Don't. I love you so
She's
much.
thanking you
She
for-
just thanks you. She understands. You're so smart.
But honestly, if somebody was in that situation and they decided not to have the surgery, I would completely understand
Yeah.
their decision. It is a life altering decision. And even when I was thinking about, you know, I worked for the school board, so I'm off during the summer, so that helped. And she used to go to my partner's business before she had the surgery. So he tried to take her, but that expressing and the dog
Right.
pooping in the middle of the office and you
It's a
know,
lot. It's a lot. It's
It's a lot.
definitely a lot for
So-
anybody to have to deal with. Sure.
So when I had to go back to work, I needed to make sure that I could go home for lunch.
Right.
Because if not, it wasn't gonna work out. So in that sense, I think for people that are in this situation, it's good that we're doing this podcast because they really need to know what life is really like. There's that spontaneous grab bag that you have in your closet, put that on the top shelf because you are not going
You ain't going
spontaneously
nowhere. You got to
anywhere.
plan the rest of your life moving
Everything
forward.
Everything revolves around the dog now.
Everything revolves around.
Okay,
dogs.
so I'd like to get a little bit into the finance side of it because clearly, I mean, it's a burden. I mean, I hate to use that word, but it's the reality of the life that you're now living, taking care as Oreo's caregiver, you know. But what was the financial cost, you know, for
So let's say
you take her you took her in, they did 1 million exams on the dog,
Right.
right? That was X amount of money. And then how much was the surgery? Like what are we looking at?
so I would say it's maybe around $400 for the emergency visit.
Right.
That
For the visit.
Just the visit.
Just the visit. Well, I don't know what tests they may have done at the emergency facility, but they're the ones who said she needs to go to a neurologist. So then when you get to the neurologist, you know, they tell you it's gonna be, I think it was $5,000 to do the MRI and
Oh
then,
yeah,
and then
they're
they'll
super
give you
expensive. Mhm.
the diagnosis and then you decide what to do at that point. If you decide to have the surgery.
She still hasn't had surgery and you're at $5,400.
I'm pretty sure it's somewhere around that number.
100%.
I might be wrong, but
No.
maybe 3 to 5.
So MRIs for dogs are extremely expensive. They're like between like $3,000, $5,000. And not every vet does not have an MRI place. So you may have a vet that you go to all the time, and they may have to send you somewhere else because that's the only place that does the MRI, especially like in your community, like depends on where you live.
Right.
You know, because that happened to General.
Right. Then they tell you if you end up having to do the surgery, they'll credit you that amount of the MRI as part of the whole bill. But I'm sure it's really
No,
not,
yeah.
it's just anyway, so you have the MRI, that's 3 to 5, let's say, and then they tell you that, the level of the dog, where they're at, in their IVDD scale. And then they tell you that the surgery is going to be, I want to say, somewhere around $12,000 or $13,000. But then they put a little clause that says 15% may need to be added depending on what happens at the surgery. I don't have the research to back this up, but they used the full 15% that they thought they might add on. The full 15% was added. And
I believe it.
they tell you that there's a 50% chance that the surgery may not work. From being on that Facebook page, level 5s,
they never work.
Most of the time, they don't work.
Like 90% of the time.
50% of the people that have reported their level 5 dog, at least on this group, not 50% of them are making it out walking. Most of them are not. Like you said, it's probably like 90% that are not. So they're not regulated, so they're not regulated. So they can basically tell you, it's $1 million to have surgery on your dog or put them to sleep, because they don't have the same regulations as human healthcare.
Right.
So I would say at the end of everything, of all the charges, it was $15,000. And so they keep the dog for a week after the surgery, and then you take the dog home. That first week of the dog being home, you feel like you are going to lose your mind. Okay. I would compare it to how some parents have a newborn come home and the child has colic. And the parents can't sleep and they don't, you feel like you're losing your mind because the dog is pooping, diarrhea, pee, no control of it. You have to wash them all the time and this and that. And then what happened to Oreo, which this is the part about the place where we had the neurology, where we had the surgery, that just really pissed us off. And because of all the poop, she got a rash, not a rash, but her butt just inflamed.
Oh yeah.
It looked like big red lips.
Yeah.
And we called them, and this is within the first week of the dog being home, and they're like, no, you don't, we don't do that here. You have to take her to an emergency visit. We're like, you guys can't even send us like a prescription. We don't know what's happening. Is the dog gonna explode? They wanted nothing to do. That wasn't their. They were only dealing with things related to the surgery.
And they don't even tell you why.
That's messed up. Right. That is 100% related to the surgery.
Right. So we have to go to the emergency room.
Right. Another $400.
Another $400. And
it's a scam. It really is a scam.
I can tell you why that happens also.
But when we take her to the emergency room, you get the vibe from the doctor who's treating her that if she was at level 5, why did they push you into having the surgery? Because the dog is not going to walk. Because at this point, remember, we're thinking the dog is going to walk again.
Yes, exactly.
They're like, your dog's not going to walk again.
Right. So
level
why
5s don't walk again.
Right.
Right. So you can tell, whatever. So that's another amount of money, and then you bring her back home, and then you got to do all that care. Mm-hmm. So how are we going to do all this care and go to work?
As she's falling asleep.
So that, or even, they didn't even say, go and buy 1 million puppy pads and Desitin, because if we knew about Desitin, that wouldn't have happened to her. right?
Oh.
But they don't tell you any of this. They give you one lesson on expressing.
And
Well,
that's
that could also be, it's like anything else, right? It could very much be the clinic that you just
Well, you
ended
have
up
to
taking
tell-
your dog
Well,
to,
it is the
right?
most popular one in South Florida.
And they also have to tell you, so she's gonna be pooping on herself all the time, and you're gonna be constantly wiping her. They have to tell you that what you should do to wipe her instead of wiping, because it gets irritated, which used to happen to my dog Luke. Especially with my mom, because she would, limpiarle,
Overwipe.
limpiarle fondillito. You overwipe them, it irritates them, and that's how it gets swelled up. So instead of wiping them all the time, just like you would do for to a baby, you wash them.
Right.
Because that it prevents it from their it's like their anal glands and all that stuff gets inflated.
Yeah.
Right. Yeah, so it was.
Well, it's all the chemicals also on the wipe too,
Like
right?
the baby wipes, because that's where you go to clean, just like you do a baby.
Right.
And then they get super, super irritated.
So it was, and everything during, after, you pay all this money, right?
That would be infuriating. I really would.
Couldn't give me a care package,
Right.
Right.
even with one item of each thing. So I know I
Right.
can go to the store and buy
And buy that.
It's what you're gonna need to
a
prepare
freaking
for your.
sample of Desitin, and I'll go buy the whole container
Right.
or whatever it is, right? So you have to learn all that on your own.
Right.
It gets, it's a desesperación. Like
Yeah.
you feel like you're gonna lose your mind, and then that's how you end up going on Facebook pages. And a recovery of a dog that just had surgery you shouldn't learn how to deal with that by having to go on Facebook.
Trial and error, yeah.
Trial and error.
Yeah.
Like that should be something where
The doctor should be the one, the
Right.
vet should be the one telling you exactly what you need to do. And if you call them and tell them, hey, this is happening, they should absolutely be able to guide you at that
Right.
point. They perform the surgery.
right.
Because they know that this happens, like that. Yeah, that's
So that whole thing, that was a horrible and honestly, when I do remember the doctor saying, so this is gonna be life-changing, but that
to
was
what
it.
extent? Yeah.
It wasn't like this is gonna be life-changing,
Right.
guys. Like remember,
Like trying to
there's
almost talk you
no
out of it.
Pet sitters that take disabled dogs. So that's been my experience
Right.
so far. I'm speaking for myself. In the last year that I've tried to find someone, we have somebody, but they're friends.
Right.
This is not a facility.
Right.
And they don't tell you that. They don't tell you that, if you work long hours and you're the only person there, you work 12-hour days, that's not going to work.
Right.
They don't tell you life changing. What do you mean by life changing? Because life changing to me is my dog used to walk and now my dog can't walk and my dog is in a wheelchair.
Right.
That is life changing on its own. Like,
Right.
can you tell me the extent
Right.
of life changing? Because for us, it's been huge,
Yeah.
and but so going back to the cost, it doesn't end there at the 15,000.
No.
So they recommend, the facility did not recommend therapy, but people that we were talking to who said, take the dog to therapy. If there's any chance the dog is going to walk, it's going to be through therapy. The dog is not going to, if there's recovery of the dog walking, it's not going to be on its own. It's going to be from therapy, just like a human.
Right.
Right?
Well, it makes sense.
Surgery.
It makes sense.
Be therapy,
sense.
That's
That's also an
So-
expense now, right?
Yeah, that's about $100 a day.
It's insane.
And like says 3 times a week.
And yeah, and it's 3 times a week, some people actually, I don't remember
Freaking
now if
boy.
we left her there for a week or so because they kind of like it right at the beginning to keep them there.
Uh-huh.
Now, I do have to say that my experience with the therapy facility, Art and Davy, was fantastic.
Okay.
That's
Like
so good.
Something positive.
they were the best and they were honest. When they saw that her therapy was not producing a result, they were like, if you want to keep bringing her, bring her, but
They were not going to
They
continue
were
to take
not
your
gonna-
money.
Yeah.
they were like, we just think that, her nerves are dead. And even though it looks like her leg is moving, it's not going to work.
Yeah.
So they were great, that facility. They also told me, and this is why I don't take her to medical boarding, is that she gets super stressed being in the cage, hearing all the other animals around. Like, she's a
Crying.
nervous wreck.
Anxiety.
She gets a lot of anxiety. And even when
I understand you.
when I asked them about them boarding her, so we could, take a trip somewhere because, and I know that's, that's our hobby, right?
Right.
Traveling. So, they were kind of like, we'll take her, but pobrecita, poor thing, she's, don't be gone that long,
Right.
right? Like she's gets super nervous and, um, but they were fantastic. They understood. You didn't feel like you were getting $100 a day for therapy. Honestly, isn't a lot,
Right.
especially if you start calling around. That included like acupuncture and like them doing different
Yeah,
things with her.
but we go back to not a lot of families, and what
Can't
about the
afford it, right?
elders
Yeah, like,
that have pets, right, as companions?
And they would keep her from 7 to 5. Like you
the
drop
whole
her off
day. It was like a
before
day.
work.
Yeah.
It was like a therapy
Free
daycare,
daycare, yeah.
right? So, and if there was something wrong, like she had a UTI at one point, I would, on Wednesday, I have to go take her to therapy. Wednesday, there's a doctor on the site
Oh, they were.
that would,
Okay.
so that whole part was positive, but, here we are.
Here we are.
And so I would say from the emergency to the end of the therapy, I would say 21,000.
It's a lot of money.
A
It's a lot of money. It's a lot of money for most families,
And a lot of people.
For me. But
Yeah.
I mean, what was I gonna do at this? Well, after the surgery, there's no turning back,
Right.
right? So you already said I'm not putting her down and did the surgery. Now you got to make it work, right?
Yeah, now at
You're
this
not
point,
gonna
like you're
go
stuck.
and-
Yeah, no, you're stuck.
Such a happy dog.
You're stuck. You're
She
stuck
is,
now, you
like-
know?
She's so happy. She
Yeah.
runs around like
She
a
really is.
madman
She's
through fields.
she's funny. Well, we'll post some videos so that you guys can see her going cuckoo. Yeah, she's like this crazy little
Like she's normal.
Frenchie on
She's
wheel.
a
Frenchie
normal
on
dog
wheels.
that can't, unfortunately can't walk.
We call her Crippy.
Right.
Crippy.
I try to monitor her, keep an eye to make sure like is this the right thing for her or not?
Right.
I know like sometimes she's sitting on the couch and she wants to jump off the couch, but I told her no.
Right.
So she she's obedient dog, so she won't do it. So I kind of judge, but I really haven't seen her like with like what you would say depressed,
Mm-mm.
sadness,
At all.
or
Moping
anything,
around.
At all.
around.
At all.
Not
At all.
He tries to play with other dogs.
Yeah. She's great. You like I said, and I'm not joking when I say that, like you're doing the Lord's work with this, because really it's extensive. Like I'm seeing her when she's here at my house, and it's a private thing that they do, but she's constantly like having to squeeze her pee out, and she hasn't pooped since she's been here though.
But I think that's also.
But you can smell the farts.
environment.
You can smell the farts. Oh, you can.
I do have to say that, for some people, and so some tips, it's like, it just depends on, your dogs. It's like, if you're ever in this situation and you're a super hypohygienic person, oh gosh, she can poop like 3 or 4 times a day
Ugh.
at any time. And like I said before, I try to keep her in the pamper, but she already had one UTI for being in the pamper.
So you keep
So
her
you have
without
to
it?
kind of balance it out, so, there's been.
I'd rather clean poop than have to take her to the vet.
100%. 100%.
Say that because sometimes when people come over, she gets excited, and what do dogs do when they get excited?
Yeah.
They
Poop.
poop.
Yeah.
So she's in a wheelchair or she's scooting around and she's peeing and she's pooping, and I can tell by people's eyes, they're just like horrified about what they're seeing. But it is.
It is what it is.
It is what it is. You're here. You're doing a great job with her. She's a very happy doggy.
Super.
So to close out the podcast, I think this was really this is an important topic. I think that a lot of people deal with this. I personally, when I was younger, I worked at a vet's office for some time, and I did see that they would take advantage, especially of the older people that had pets, and like I said, those pets for them are almost like companions, because their wife passed away or whatever the case may be. They're on limited incomes, and they would come at them and give them all kinds of scenarios where their pet was going to die in order. And then you see these old people like, okay, I'll figure it out. Here's a credit card. And I just thought that that was such an ugly thing to do. Like you're taking advantage of an older person, you know, at least do that in a really high end area. Malibu, go rip all those fuckers off, you know, but not, you know, not older elders in Hialeah, you know.
I can give you a comparison of a vet visit. Miami versus, let's say, North Carolina out in the country.
Even Clewiston, right?
Right.
Like even in
So,
Clewiston, there's a
but
lot
from my
more.
experience, because obviously of my two dogs, right? So if every time I would take Luke or Leia to their vet in Miami, it would cost me between $400 and $800, depending on the situation.
Yeah.
Right? That was every time I would take them, and which was towards the end, it was kind of often. In North Carolina, and this, okay, let's just do this. For blood work, right? An extensive blood work in Miami will cost you about $400 and let's say $80. In North Carolina, where we have the place now, we go to the vet and the same exact blood work, because I compare them, is $175.
That's insane.
Yeah.
Look at the difference.
And I get the results right at the moment because they have their whole facility in North Carolina. And here at the vet, you're like, you'll get your results in like 2 days.
Right.
You know what I mean?
It's a
But the
ripoff.
price-
It's a ripoff. It's extortion.
and it's literally the same because I compare them. I was like, okay, let me see
Yeah.
where they're at. Like what
They're
changed,
taking
you know?
advantage of people
in
and
big cities.
in big cities. And we can only, you know, testify to Miami because we've all experienced that. And like I said, I worked in one clinic for like 2 years, and I personally saw it patient after patient after patient. So, you know, to close out the podcast, Barbie, again, thank you for this. I hope that a lot of people can gather some information. Maybe we can post the forum that you're on Facebook. For those of you out there that have a Frenchie, because it's specifically targeted for Frenchies, the one that you're
It's
in.
common.
Yeah.
50,000 members, and those are only people that are out there looking for them, and it's all Frenchies.
So I'll go ahead and I'll post the link to that forum so that you guys that are interested can join. I personally know a lot of people that have Frenchies. Yeah, this is like a hot breed, right? Like they're so cute.
Yes, they're so cute.
Everybody wants
They're
one. Yeah.
They're very needy, guys.
It is-
If you
it's
want
a-
a Frenchie, they're a lot of work. A lot of work.
You know, it's a very popular breed, and unfortunately they don't know why it's happening. So it could happen to any Frenchie at any time.
Right.
You know, they don't know. And so I would say if you're thinking about getting a Frenchie, or you have one, at least, I don't know how much the dog insurance is, but I would definitely at least look into
Maybe
it.
that would be right.
And
That would be a
also
good
be
recommendation.
vigilant about like their movements.
Right.
You know, that way of like, okay, well,
Right.
today she didn't get up right away, and tomorrow she doesn't get up
Right.
away.
Don't wait. Don't
You
wait
know,
because
take it
maybe
the level can be like, maybe she's not a 5, but maybe right now she's a 3, and if we take
with
care of it at a
therapy,
3,
right.
it could, you know, like,
But you'll probably still have to do an MRI.
oh yeah, that's 100%.
So you're still doing the
You're
3 to
still gonna
5
spend
grand.
Get the insurance. Get the insurance no matter what. That's the bottom line with all
Or
this.
maybe be vigilant and like try to, I guess, educate yourself.
Yeah.
Because we didn't know.
Having a dog is expensive, you know, a lot of rewards, right? But there's also, you know, it's like anything else, right? It's just it's a living human, almost human thing that we love so much. It is a human. It's an almost human.
Almost
It's like a
human.
furry human. It's like a
She is
it's like a
baby, look at her.
it's like a hairy human.
She's always sad like this. Like if she's a toddler, it's freaking hilarious. This one here thinks she's a human. She wants all the rights of a human.
It's so funny because my dog with my dad with Fletcher, our little Yorkie, my Yorkie who became his Yorkie, they both started looking the same. They limped the same. They had the same
Are you
limp.
trying to say Oregon's starting to look like Barbie?
No,
Or
that's not what I'm trying to
Oregon's
say.
starting look like
What I'm trying to say is that when they had to finally put Fletcher down because he was just old and had a million health issues already, and they took forever to do that because our pets last like 20 years. They really do. They last longer than normal.
Mine lasted 17 and 20.
yeah.
19.
But my father, who is a macho man, I had never seen him cry until Fletcher died.
Oh, yeah.
Like that man was bawling on the couch all the time over his dog because they were just so tight. And you end up loving these little critters so much. So thank you, Barbie, for sharing all this information. Madeline, thank you for pitching in. You've also always had, you know, dogs and you're an excellent, you know, mommy to your pets, I think you should get another one, you
No,
know.
one's enough with Zoe right now.
They have Zoe right now, a schnauzer. Zoe's weird.
Zoe's good.
Zoe's weird. Like, I feel like she's angry.
No,
She's like an angry little schnauzer, you know?
not.
And based on the way Oreo eats and acts, she's probably gonna be around for a long time.
Oh
for
yeah,
sure.
she's not going anywhere. You ain't going to Europe for a while. Oh, but
That's
this
true.
was great, guys. So thank you so much, everyone, for tuning in and joining on this very informative educational podcast. I thought it was great. Oreo the superstar, say bye. Bye. Thank you guys for watching, and until the next one. And please don't forget to subscribe. It really helps with bringing on great guests. We have to put the little thingy that says click here. It helps a lot with bringing in more guests with great valuable information that we can share with all of you. So thanks again, and until the next one. Bye.